Hi, I'm Raoul Goldberg. I'm a medical doctor who's been practicing integrative medicine for the past 35 years. And I practice a form of integrative medicine which I call participatory medicine. Participatory in the sense that practitioner, the patient, and the therapeutic partnership itself are actively and dynamically engaged in a participatory process which significantly enhances the diagnostic and therapeutic outcomes. So let me explain what I mean by all of this. First of all, I, as the practitioner in the consultation, must make sure that I do not bring my own internal distractions or projections into the consultation. So I may be feeling a certain antipathy towards this particular patient. I need to access this and remove it so that it doesn't disturb the relationship. I do this because the participatory medical training that I offer, and which I have been trained in, enables me to access very quickly the internal emotions. And I do so by learning to express the emotion physically. The antipathy, for example, might feel like an aversion towards this particular character, and I notice this in myself and then have practiced to look at myself by seeing myself from the outside. In this objective position, I can see the after image of this person who's shrinking from the relationship. I have to clearly remove that and make sure that that is not present and place instead an empowered physician to continue the conversation. So the next step is to engage with the patient. And again, the participatory training enables me to guide the patient to get in touch with their own internal processes. So the patient comes, for example, with a headache, seeking advice and help. I ask them to express the headache through, again, gesturing it with their hands and ultimately with the body, so that they may express this headache in the form of a tightening, a pressure effect. And once he's got that and does it with his whole body, I get the patient to step out and look. And we are both looking at an after image picture which reveals invariably a whole story. He might say, I see myself under huge pressure domestically or in my employment. What do? We have to do something to remove that pressure and to help the one who's under pressure. We do so by some part of this patient taking away the pressure, pushing it away, and coming there in support of the one who is suffering. Through this, both the practitioner and the patient elevate their awareness to a heightened consciousness. And so a therapeutic partnership is created into which all kinds of new ideas, all kinds of new resources and new possibilities for helping the patient come about. And of course the practitioner is inspired in his own way and uplifted and vitalized through this process. This is just one small picture of what we do in the participatory medical training. The three modular training will equip the participant with a deep insight and experience in conducting a deep integrative counseling process. The first module will focus on getting to understand and experience the self in its different aspects, the bodily nature, the psychological nature, and the spiritual nature. The second module will be concerned with the partners and the characters that abound in the psyche, the biographical characters, the dysfunctional characters, the addictive characters, the family projections. All of this will be experienced in a very living and dynamic way. The third module is focused on the community, the relationships that one has within oneself. All of these as a way of getting deep empathy, compassion, and understanding for the client and their positions. And at the end of this module, one will have deep understanding of the I, the you, and the we, and one will be able to apply it through the techniques that one learns in every consultation and in every encounter with patients, but also with people in general. In addition, this training will give 48 CPD points